Let's clear up a myth. Canadian healthcare isn't truly free. You've probably heard that you can just walk into a hospital, get treated, and leave without paying a cent. Sounds great, right? But it's not the whole story. The idea of free healthcare is a national legend, like riding moose to work. We're proud of our system, and for good reason. Nobody should go bankrupt because they got sick. But free is misleading. Nothing is free, except maybe your neighbor's Wi-Fi. Our healthcare is publicly funded. That means we all pay for it, together through taxes. The government acts as the main insurer. When you go to the doctor, you show your health card, not your credit card. That card means the government pays the bill, not you. This removes the fear of catastrophic medical bills, a real problem in many countries. But remember, the money comes from all of us. So what's actually covered? What isn't? And why does your experience in Halifax differ from Calgary? We'll break down the price tag, the pros and cons, and what you really get. Think of this as your user manual for Canadian healthcare. Let's dive in. So what does your health card actually get you? The Canada Health Act sets the rules. All medically necessary hospital and physician services are covered. Break your leg, get pneumonia, need emergency surgery? Covered. Family doctor visits, walk-in clinics, specialist referrals, diagnostic tests like X-rays or MRIs, all covered. The system's core promise access to doctors and hospitals based on need, not ability to pay. Imagine you break your arm hiking. ER visit, X-ray specialist cast, even an overnight stay. No bill for hospital or doctor services. That's Canadian Medicare. But medically necessary is the key phrase. It decides what's in and what's out. If a doctor says you need it to maintain your health, diagnose, or treat an illness, it's usually covered. This includes everything from childbirth to cancer treatments. The system is designed to handle the big, expensive stuff, so a medical crisis doesn't become a financial one. It's peace of mind knowing the system is there when you need it. But not everything is covered, and that's where things get complicated. Let's look at what's not included. Here's where the free part falls apart. Lots of common health services aren't covered. Prescription drugs, not covered for most people. You pay at the pharmacy unless you have private insurance. Dental care, also not covered. Cleanings, fillings, root canals out of pocket. Eye exams and glasses, same story unless you're a child or senior in some provinces. Ambulance rides often come with a hefty bill. Mental health, seeing a psychiatrist is covered, but therapy or counseling usually isn't unless it's hospital-based. Physiotherapy, chiropractic, massage therapy, mostly private. Many Canadians rely on workplace benefits or pay out of pocket for these services. So, while the system saves you from huge hospital bills, everyday health costs can still add up. Universal coverage has gaps, and they matter. Canada doesn't have one healthcare system. We have 13. Each province and territory runs its own plan, so what's covered and how long you wait can vary wildly. Fertility treatments, prescription drug coverage, ambulance fees, they're all different depending on where you live. Wait times for surgeries or specialist visits can be months longer in one province than another. This postcode lottery means your access to care depends on your address. Provincial control lets regions tailor care to their needs, but it also creates inequities. 2 Canadians, 2 provinces, 2 very different experiences. It's a strength and a weakness, local flexibility, but national inconsistency. Always check your province's plan for the details. So how much does it cost? The answer? A lot, and it comes from your taxes. There's no separate healthcare bill. It's bundled into your income, sales, and corporate taxes. The more you earn, the more you pay. Estimates suggest a family of 4 pays over $17,000 a year in taxes for healthcare. A single person, about $6,000. Some provinces used to have health premiums, but most have rolled them into general taxes. Employers may also pay payroll taxes to help fund health services. So you're always chipping in, directly or indirectly. Think of it as prepaid healthcare. You pay throughout your life, healthy or sick. The healthy help pay for the sick. That's the social contract. Higher taxes, but universal access. Canadian healthcare has real strengths and real weaknesses. The biggest pro, universal access. Rich or poor, you get the same care for medically necessary services. No one is denied life-saving treatment because they can't pay. Hospitals focus on health, not profit, leading to good outcomes overall. But the biggest con? Wait times. For non-emergencies, you could wait months for surgery or to see a specialist. The system rations care by time, not money. An aging population and doctor shortages add pressure. Many Canadians lack a family doctor, and gaps in coverage for drugs, dental, and mental health create inequities. It's great in a crisis, but ongoing care can be frustrating. The system is always under review, balancing ideals with reality. Moving to Canada? Healthcare should be at the top of your checklist. Most provinces have a waiting period, up to 3 months, before you're covered. During that time, you need private health insurance. Don't skip it. Once eligible, apply for your health card in person with proof of identity, status, and residency. Your card arrives in a few weeks. Apply as soon as you can. Next, find a family doctor. This can be tough due to shortages, so get on wait lists and ask around. Until then, use walk-in clinics for non-emergencies. Your family doctor is your gateway to the system, referrals, ongoing care, and more. Navigating the system takes effort, but it's essential for your health. Plan ahead, get insured, and get your paperwork sorted. That's how you start off right in Canada. So, is Canadian healthcare free? No, but it's prepaid through taxes for universal access to essential care. We pay more in taxes for the peace of mind that no one goes bankrupt from illness. The system covers doctors and hospitals, but leaves gaps for drugs, dental, and vision. It's a decentralized, ever-evolving patchwork, always debated, always changing. We celebrate its security, complain about its wait times, and worry about its gaps. It's not about getting something for nothing. It's about what we choose to buy together. We've chosen care for all over profit for a few. It's not perfect, but for most Canadians, it's a price worth paying. And that's the real story behind free healthcare in Canada.